Hey everyone, my name is Fatma and I'll be talking about the anterolateral system of the sensitive spinal tract along with my colleague Sheetal, who will be going through the second part of this presentation, which will be about pain pathways. The ascending tracts conduct afferent information to the CNS. Functionally, they can be divided into the type of information they transmit, which can either reach your consciousness or not reach it. The conscious tracts include the dorsal column medial lemniscal pathway and the anterolateral system, whereas the unconscious tracts are composed of the spinocerebellar tracts. The tracts of the anterolateral system consist of the spinothalamic, spinoreticular, and the spinotectal tracts. First, we have the spinothalamic tract, which is divided into the anterior and lateral spinothalamic tract. The anterior spinothalamic tract is responsible for carrying crude touch and pressure sensations, and the lateral spinothalamic tract is responsible for carrying pain and temperature sensations. The pathway itself is made up of 3 neurons. The first order neurons travel from the peripheral receptors to the dorsal horn, and their cell bodies are located in the dorsal root ganglion. The first order neurons can ascend or descend several segments before synapsing with the second order neuron. This is unlike the lateral spinothalamic tract, which synapses with the second order neuron in the gray matter on the same segment. The second order neurons then decussate to the contralateral side of the spinal cord and form either the anterior spinothalamic tract or the lateral spinothalamic tract. These neurons travel all the way up to the ventral posterolateral nucleus of the thalamus, where they synapse with the third order neuron. And both pathways end up in the somatosensory cortex. The spinoreticular tract is involved in the ascending reticular activating system, which plays a role in maintaining consciousness and also transmits information about slow pain. Again, the pathway is made up of 3 neurons. The first order neurons travels from the peripheral receptors to the dorsal horn. From here, the second order neurons ascend the spinal cord as the spinoreticular tract in the lateral white column mixed with the lateral spinothalamic tract. Most of the fibers remain uncrossed, but some do decussate, and they terminate by synapsing with the third order neurons located in the reticular formation in the medulla oblongata, pons, and the midbrain. The last tract is the spinotectal tract. This transmits information for the spino-visual reflexes. Just like the other tracts we talked about, this pathway is also made up of 3 neurons, with the first order neuron traveling from the peripheral receptors to the dorsal horn. From here, the second order neurons decussate and ascend as the spinotectal tract in the anterolateral white column. They finally terminate by synapsing with neurons in the superior colliculus of the midbrain.
Pain is an unpleasant sensory and emotional experience that arises from an actual or a potential tissue damage. Pain is always subjective. Pain can be acute or chronic. Acute pain is mainly associated with surgery, trauma, or an acute illness. It's a warning signal that indicates actual tissue damage or a potential tissue damage. It triggers a protective reaction in order to prevent further tissue damage. Chronic pain, on the other hand, is a pain that lasts beyond the normal tissue healing time. According to IASP, it's generally 6 months. And unlike acute pain, chronic pain plays no protective role in preventing tissue damage, like the further tissue damage, and can be considered as a disease in its own right. Types of pain include nociceptive pain and neuropathic pain. Nociceptive pain is a pain triggered by chemical, mechanical, and thermal stimuli, and neuropathic pain is a pain that's caused by abnormal neural activity that has arisen due to a consequence, that is a consequence of injury or disease or dysfunction to the nervous system. Nociceptive pain. So nociceptive pain is generally divided into 2 types, somatic and visceral pain. Somatic pain, nothing but musculoskeletal pain, is a localized sharp pain with varying duration and quality. Quality could be dependent on if it is deep somatic or superficial somatic pain. And they are generally transmitted by the A delta sensory fibers. And then we have the visceral pain. The visceral pain is a dull, diffuse, deep pain that are transmitted by the C type fiber, like type C fibers. One difference between the A delta sensory fibers and type C fibers is that A delta sensory fibers are myelinated and type C fibers are unmyelinated. Then we have the neuropathic pain. The neuropathic pain can be divided into central, peripheral, and sympathetically mediated pain. So central pain is generally caused because of some CNS dysfunction. This could be mainly triggered by some kind of lesions that are produced by an ischemic stroke. And then we have the peripheral pain that is caused by the damage in the peripheral nerves. So this could be mainly because of some issues like diabetes, because of which there could be like damage to the peripheral nerves, which causes peripheral pain. And then the sympathetically mediated pain. This is caused by the autonomic nervous system. It's the sympathetic, parasympathetic, and enteric nervous system, which are responsible for different functions such as digestion. So that's neuropathic pain and withdrawal reflex. So withdrawal reflex, a polysynaptic spinal reflex that causes a part of the body to move away from a painful stimulus. So in case if there's a hot plate and we have touched it, so we tend to move our hands away. So this is the withdrawal reflex, in simple words. And this is generally done by the contraction of the flexor muscles and relaxation of the extensor muscles. Nociceptive receptors are the first ones to detect the chemical, mechanical, or the thermal stimulus, and then the stimulus is converted into an electrical signal or an action potential, and then the C-type fibers and the A-delta fibers carry it to the dorsal horn of the spinal cord, and from there the secondary nociceptive neurons in the spinothalamic tract take over, and they transmit it to the thalamus in the CNS, and there the pain is perceived, and after the perception, it is like a response is sent along the efferent pathway, which results in pain modulation or a reaction to the pain.